So you do not need to know the sequence of a virus to act. Or you could also say in another way that knowing the sequence does not change what you need to do.
Hello, welcome to this edition of Meet the Expert, a new series of podcasts on swine disease management in practice presented by Boehringer Ingelheim. My name is Peter Best. And I'm joined for this podcast by Dr. Poul Henning Rathkjen of Boehringer Ingelheim Nordic. We will be talking about the porcine reproductive and respiratory syndrome, PRRS, and in particular the identification of the viral types encountered on a farm. Dr. Rathkjen, thank you for joining us.
Thank you very much. I'm really happy to be here. PRRS has been my passion for more than 25 years now, so I'm happy to share some of my experiences with this disease, very interesting disease that keep challenging us.
Thank you. Before you started working for Boehringer, in fact, you were yourself a swine veterinary practitioner in Denmark, weren't you?
Yeah, I was a practitioner for 15 years. So I've been working with PRRS in practice, also both trying to control it and also eliminate it. And I still think of myself as a kind of practitioner. So I know I've been in a different world for the last 15 years when I talk about PRRS, but I still try to maintain my practical view on PRRS.
But you don't have to go very far back to say that identifying PRRS virus seemed very simple. We were talking about essentially two types that seem to be somewhat different genetically and different in their locations around the world. But we didn't seem to, at that stage, know too much about the diversity within those types. Was that right? Were you identifying virus types yourself on the farm when you were a practitioner?
Yeah, when I was a practitioner, we were happy if we could just tell if it was a type 2 or a type 1. That was all we needed to know. And from that, we basically made our decisions, both on vaccines or what we wanted to do.
It's a bit different now then.
Now it's completely different. And you could say today, for many years, we increased our knowledge to look more specifically into the genetics of each of these types. But still, even now and then we have jumps in our knowledge, and all of a sudden we need to know more because we use the knowledge in a different way.
Yeah. So from the point of view of a veterinary practitioner, please, how often would someone today want to be identifying a particular PRRS virus, and for what purpose?
I think in most cases, the knowledge is not needed. So on a daily basis, you don't necessarily need to know more than if it's a type 1 or type 2. But as soon as you want to tell about the origin of the virus or where could it come from, then you need to know more than if it's just a type 1 or type 2. You need to be more specific. And that's when the PRRS virus is really starting triggering us. And the knowledge we get is all of a sudden too little.
But I referred briefly before to diversity of viruses. I mean, you've got many possible candidates out there, I should imagine now, that could come out of your identification process. Is that right? There are many subtypes or variants out there which would give you cause. And this diversity, I think, is true for both type 1 and type 2, isn't it?
The diversity is increasing for both types. And for many years, I think we thought that maybe the diversity in type 2 was much more than in type 1. But that was probably because we did more sequencing in US, where the main type is type 2. And then over the last years, we started to sequence much more in Europe. And now we have found out that diversity in type 1 is even way bigger than in type 2. And it's increasing all the time because the virus, every time it replicates, it's mutating, it's recombining. So just from that point of view, it's like a cloud that is spreading. The diversity will be bigger and bigger.
And this is not something that's happened very recently. This is throughout the period of evolution of PRRS viruses. this is happening, that this huge diversity has occurred.
Yeah, that it has been there right from the beginning.
Yes.
It's not a new feature of PRRS virus that all of a sudden it started to mutate, or
Yes,
all of a
yes.
sudden it started to recombine.
Yes, yeah.
But we were not aware of it in the same sense as we are now.
Yes.
The more sequencing we do, the more we find out that it's mutating and recombining. And for many, many years, we were just looking into a very small part of the genome, and then we thought it was, you could say, relative stable. Now that the tools are there, that we can look at much bigger parts, and all of a sudden we understand that we have been more or less blinded. We didn't see very much of what was happening.
For our friends out there listening to this today, you talked about sequencing. If you wouldn't mind, for my benefit, just remind me, what do you mean by sequencing, please, in this context?
Yeah, so the PRRS virus has some what we call open reading frames, and we use these open reading frames to look at the composition of the specific nucleotides. So in which order do they come? And that order is specific for each virus. And now, if we know that order, we can now compare that order in different viruses. So basically, we can put them up on, put all the order in a line, and then from one virus, and we can then take the order of the nucleotides from another virus, and completely make a complete comparison of these two. And now we're able to see if they are completely identical, or if a few nucleotides are different in one or the other. That would normally be what we see on a normal conditions. But all of a sudden, one virus take a big chunk from another virus where it replicates. And all of a sudden we have a creation of a completely new one, and that's what we call a recombination.
I see. But you talked about this result, but I would like to know, you're taking a sample from somewhere and you're sending it to a lab, are you, or are you doing it yourself? And how long does that take? Could I ask you just to say with sequencing, what is the process in practical terms, please?
So yeah, you take a sample, you send it to the laboratory do a PCR test and identify the virus. So now they know that they have a virus, and they know more or less how it looks like. Then you put some primers to look into the specific nucleotides. Usually we looked into a very small part because we thought that would be enough to identify it. Like if you have a family and you think, if I just know the last name of this family, I'm fine. I know how they are.
Yeah.
But then all of a sudden we know that that's not enough. We need to know more than that. But so just the sequencing, or in what we call the open reading frame 5, the 606 nucleotides, that takes only a few days.
And that relates to a particular glycoprotein, does it, in open reading?
Yeah.
I'm going to say
That's
ORF 5.
The open reading frame of the structural protein, that's
Yes.
what we look into.
Yes. But how reliable is this? You've talked about quite fine differences in identity, according to what I'm hearing you say. Is this a very reliable process?
It is a reliable process if you could say, correct yourself. So if you did it just once and do not look for if the sequence you get is correct, how can you sure that it's correct, to put it in another word?
Yes.
So when you have a set of nucleotides, you can read it from left to the right, basically, and then you can read it again from the right to the left, so back and forth. And of course, you need to end up with the same results. What good labs would then do, they would not be satisfied with doing this only once. They would probably do it 3 times. And then if you get exactly the same sequence of nucleotides, then you say, okay, I know exactly what this virus looks like. Sometimes you could have 2 viruses in the sample, and that they are mixing up. And because they're mixing up, you wouldn't get the same results when you read it back and forth, so to say. And now you know that something's wrong. You know, maybe you don't know exactly what's wrong, but you know that Either you have two viruses or your reading of the nucleotide sequence is wrong.
Yes, yeah. But also, if I may, the comparison has to be with your results, with the database you have. You have to have a library of identities with which to compare your results. Is that correct?
Yeah, so when you have a sequence from one virus, then you can start, or from several viruses, that you can start to build a library. You could build your own library of sequences that you would then be able to compare, but you can also go to GeneBank. It's a place where sequences are uploaded from other scientists, researchers, or labs, and then you can use them for comparison. And then there's other tools, for example, University of California built a bioportal, a disease bioportal, where you can have a project, build a project where you could upload your own sequences, or you can go together with others and build your library of sequences to have something to compare with. So just having one sequence from one virus doesn't give you a lot of information. So you only know something when you are able to compare it with something else, with at least another virus or 10 other viruses.
Yes. You are listening to Meet the Expert, a new series of podcasts on swine disease management in practice presented by Boehringer Ingelheim. If you would like to know more about the subject we're discussing in this podcast, additional information is available offline. So let's go on to that. We're talking, therefore, about looking at the phylogenetic analysis, I think is how it's described, of the virus's identity as characterized by this ORF5, this open reading frame. So is this a very time-consuming process between taking the sample and getting a result back with the interpretation? Does that take a long time, or is it very automated now?
It's quite automated, so it would not take a long time. You could, within a week, you would have the sequence of the virus you submitted to the lab, and then you can start the comparison. You can ask the lab to do some comparison, but you could also go into GeneBank or other places to look for it. And there are tools out there that you can use on your own. So you could use Bioportal. It's open for everybody to use that.
It's
that
a
tool.
public access.
It's a public access, yeah.
Yes.
And then there are some you could say some sequences there already. For example, the different vaccines would already be in the library, so you can start the comparison.
Yes. Is it an expensive process to have done? If you're a veterinary practitioner advising a farm, would you be considering the cost to be one of the big limitations today?
It's still sort of expensive. The prices for a sequence in ORF5 would vary between labs. So yes, it's relatively expensive compared to just get you could say just get a PCR results that shows that you have a virus, if it's one or two. Yes. It's an additional cost. So if you don't need it, there's no reason to do it. Just for fun, you would say.
Yes, yeah. And so let's get on to that, about its value. So first of all, what is its value in veterinary diagnosis regarding PRRS? What would you say the primary value in practice is?
Yeah, so this tool is, first of all, it's an epidemiological tool. And it's good for that. It's good to study how PRRS virus has moved, for example, within your farm, or to have come in where it could come from. So if you have a PRRS infection in your farm and you wonder where could it come from, you can go then into the sequencing, and then if you know the virus composition of your neighbor, what they have in their farm, or what would be in the area, or has this PRRS virus been in this country before? Then you can start to get an idea of where it could come from. But there's limitations to what you can use it for as well, of course. But it's, first of all, it's an epidemiological tool, and therefore in many cases it's more for researchers than for the daily practical use.
It's certainly not an everyday tool even today. It is when an episode demands investigation that you would suggest that's where it has its value now.
Yeah, for example, if you, let's say you are vets and you are looking after several farms in different areas, and you know that they're PRRS positive and they have virus circulating, and then you could start to look into where are they sharing some PRRS viruses. So could there be a common origin? Do they have transportation that could carry PRRS virus around? Is there animals coming from one farm to another that carry PRRS virus, or has it been brought in with semen? So that kind of investigation you could use it for. So kind of a biosecurity tool to check your biosecurity. How good am I in my external biosecurity? So that's one way to use it. If in my farm, I have identified a PRRS virus, and the next month I do another sequencing, and now I find a new virus, and next month a new virus again. Then you know you're bringing in new viruses to the farm all the time, and probably you should have a closer look into your biosecurity, your external biosecurity. On the other hand, if you identify PRRS virus in your farm and it continues to be the same month after month, or maybe year after year, you know at least you're not bringing something in from the outside. You are maintaining what you have, and then you should probably look more into your management and your internal biosecurity. So that's another way you could use it. So internal epidemiological investigations.
I understand, but are you suggesting then it could be done as a matter of course every 6 months or year to see whether the situation has changed? Or are you saying look at the clinical situation and then make a decision from that?
No, I would suggest that if you want to use sequencing in a farm or in a production, then you need to repeat it continuously. Maybe not every year, but no, every month, but every half a year or once a year. Check what you have in your farm. Has it changed over time? So that it gives you a hint if you need to look into biosecurity. Just doing a sequence once doesn't give you a lot of information, actually.
Let's talk about biosecurity then, on to the practical aspects. So you've used sequencing, you've identified what has happened or has appeared to happen at these diagnosis checkpoints along your production flow, and you want to look at your biosecurity in that regard, particularly as regards PRRS. Would you have a starting point as a practitioner? What's the first thing that one should be saying to the farmer about checking biosecurity? What's the first step to check biosecurity?
So we have built a tool, Combat, and the first step is to go into an investigation of your external biosecurity and your internal biosecurity and your management and pig flow. We built a tool to look at the risky events you could have in that. When we talk about this and want to use PRRS sequencing in that respect, we always, so maybe go a little bit back and say that what we want for a sow farm, for example, is to have a stable sow farm. Even if we are vaccinating the sows, we want to have the output of PRRS virus negative piglets. So first of all, we want PRRS virus negative piglets born, and then we want to wean PRRS virus negative piglets. Later on, we want to have them PRRS virus negative out of the nursery and then out of the finishing as well. But the starting point here is always the sows and a stable herd. When we talk about PRRS sequencing in that respect, we can use that kind of checking. First of all, if I have a PRRS positive in my finishes, do that origin from the south? Is it the same sequence we have with the south, or is it something different? Meaning that if the origin is not the same, or the sequence is not the same as you have in your south, you must have a break in your biosecurity somewhere in between. You're bringing in virus from the outside during that process.
And you get some idea of timetable when you might have had that break, because your results are today, but I don't know how quickly you would be seeing the necessity of sequencing and finding this virus in the finishing stage. Has this event happened some time ago, or is PRRS a very rapidly developing infection and could have been quite recent?
It could have been quite recent, and it can be very fast. So you could have a virus introduction today, and tomorrow you have or in a week you have all the animals infected, or it can be slow. So you never know with a PRRS infection if it's fast or slow. On normal conditions, if you have, you could say, a normal type 1 virus infection is not very bad. It would be a quite slow infection. But on the other hand, if you have a very aggressive one that creates a lot of very high virus titers, it could infect a lot of animals very fast. So just looking at that, and that is important maybe when we talk about sequencing, just to mention that as well, that just looking at the nucleotide sequence of a virus does not give you any hints of if you are dealing with a good or a bad PRRS virus, so to say.
In terms of virulence, or
in virulence, pathogenicity,
yes.
will the animals become sick? You have no clue just looking at the nucleotides. It would be the same as if I'm saying, I know that all the best family, they are bad. That's not true. So you have to be much more specific. You cannot just look at the family name and then you know if they're a good or bad person. Everybody is individual. And the same with PRRS virus. Just knowing a short piece of the nucleotide sequence does not tell you anything about virulence or pathogenicity.
And how do you do that from your experience or the farm situation, or what is the reliable way to judge that?
This is really tricky, actually, because the only tool you have here is actually to look at the animals, and that's what old veterinarians would tell you. If all fails, have a look at the animals.
Yes. Are they breathing? Yes.
And that would be exactly the same here. There's nothing in a lab that can give you that hint if this is a good or a bad virus, if it's a nasty one or if it's a baby, it behaves like a baby. You have to go and look at the animals. And then it becomes even more tricky, because we know that we could take the same virus, even if I took it directly out of pigs from one farm where it behaved very bad, we can put it into pigs in another farm and absolutely nothing would happen. Researchers would know that very well, because very often we like to have challenging viruses and use them in a lab when we do challenge studies, and we try to look for nasty viruses to do those challenges. And very often when we put them into the lab, then all of a sudden they behave like a baby. So this is very tricky, and there's actually only one way to study it, and that is go to a specific farm and then identify the virus that you have there.
Yeah, but that is that's an opinion more than a fact-based thing, is it? Then it's what your gut feel is about what you're seeing on the farm, or can you measure anything which substantiates?
I'm sure that some farmers would say that it's more than a gut feeling when you have a huge number of stillborns or sows dying or abortions.
Sure.
So yes, for sure you can measure it.
But
if you have abortions and stillborn piglets and you identify a specific virus from those, in this situation this virus behaves badly.
Yes.
And of course there's some hints. So we know the best example probably is highly pathogenic PRRS viruses from Asia, we know that if we put them into another farm, they will behave badly as well. But it's still not linked to anything we can see in the sequencing.
In the genetic identity
Exactly.
of it. Yes, I'm with you. But you said about, what the farmer would say. I think farmers would also say to you, what is the reason for sequencing to identify something that's already happened on my farm? Surely what I want to do is get rid of it or control it.
Yeah.
And it's all very well blocking that hole in your biosecurity, but the damage is done. So, what before I start blocking biosecurity and going through my steps of combat, what should I be doing in terms of reacting or responding to the current situation that you've identified?
Yes, so you're right, absolutely right. If you look beside the actual epidemiological events or studying that, the behavior or what your action on the farm is not dependent on the sequencing. So you do not need to know the sequence of a virus to act. Or you could also say in another way that knowing the sequence does not change what you need to do. So that is always, that would always be the same. And what we aim for, again, is a stable sow herd with an output of PRRS virus negative piglets. And I think that is actually not that hard, you could say. I'm sure now some farmers and vets would not agree with me, but we actually know, to put it in another way, we actually know what you should do in order to control PRRS. So you need to stick to the 10 management rules of PRRS management rules, and we could share that later on if somebody wants those. And so that is about cross-fostering of pigs, not maintaining the PRRS virus in the different compartments by mixing pigs and so on. I don't think we will go into the details of that, but that's something we could share. This is something you have to do. You need to immunize your animals so that you have no susceptible animals. And so the program you need to follow if you have a PRRS infection on your farm is, you could say, relative simple. Maybe it's not easy to do, but it's relative simple.
It's been proven time and again.
It's proven, yeah. So that's have a good management and a strict flow of pigs, immunizing the animals, the sows and the piglets in the whole herd vaccination program.
Okay.
That's basically what you have to do, and that does not change.
That completes the first episode of this podcast, but please stay tuned for the second episode, which is available.